the third trimester, we typically do the diabetes screening. That's the 1-hour glucose test. And then we also do the anemia screening, which is a CBC. And then we also add on some STD screenings that the state recommends just to make sure we're not missing anything late pregnancy. The glucose test is important because we know that undiagnosed diabetes does carry a risk of fetal stillbirth. And so just to make sure that we're monitoring everything we can during the pregnancy, we want to make sure if we do find it that we go ahead and control it well. Gestational diabetes we often will see in pregnancy happen in the third trimester. We're seeing it more and more as we see more obesity in the community, and just family history risk does put you at risk. And like I said, it does increase the risk of fetal compromise, so that's why we want to make sure that we're screening for it and we catch it. With gestational diabetes, it does come with its own risk factors as well, and so just being aware of those and monitoring the baby's growth to make sure the baby's not getting too big, monitoring the fluid around baby because we know excess fluid can come with that. And then we know that there's risk at time of delivery sometimes, things like shoulder dystocia, and obstructed labor. And so that just really gives us an idea of what to be looking for even when you're laboring. And so that's why we highly recommend that we are watching it. With gestational diabetes, you monitor your sugars throughout the pregnancy and try to control the sugars with diet as much as possible. A lot of ladies only need diet controlled. Sometimes we do have to add on medications. The safest one, of course, is insulin, but I know a lot of patients don't want to do the injectables. And so we do offer the oral medications, and we can talk about risks of those at that time if it's recommended. And then we will monitor closely if we're having to control the diabetes with medications, either insulin or oral, just because we know that risk does increase for the fetus, knowing that we've got more risk with the diabetes. It also is kind of a precursor to, are you going to get diabetes later on in your life? So if you've ever had gestational diabetes, it's a good idea that after the pregnancy that we screen you for diabetes outside of pregnancy, and then that we continue to do that routinely about yearly. In pregnancy, we recommend in the third trimester the Tdap vaccine that can be given anytime from 27 to 36 weeks. The reason we recommend that is because it covers for whooping cough, which is pertussis. And so when you first get the vaccine, the type of antibodies your body makes will cross the placenta and give immunity to the baby, and then will protect the baby for the first few months of the baby's life. Even if you've already received the vaccine prior to the pregnancy, they still recommend going ahead and doing it again in the third trimester because it's those initial antibodies that give the protection. The other vaccines that we offer in pregnancy, we do have the RSV vaccine now. We give it during RSV season, which is about September through January. We give it between 32 weeks to 36 weeks, and the idea is to help protect the baby after birth for risk of RSV, which if you've ever heard of, can be very debilitating for babies, and so it's nice that we have this option. The other and final vaccine we usually recommend during pregnancy is the flu vaccine. So if you happen to be pregnant during the flu season, we will recommend consideration for that. Very safe in pregnancy. It not only helps to protect you, it can protect the baby too for the first few months of the baby's life. We know that ladies in pregnancies, the immune systems are down, so if you get the flu, it can usually be a more severe reaction, and we've seen it lead to hospitalization at times. And so even though you don't usually get the flu shot every season, it might be a good idea to consider getting it while you're pregnant in order to prevent that hospitalization risk. With kit counts, we want to make sure that you've done something to help the baby be a little more active as much as possible, and then you want to be able to really focus on it. So I usually recommend that you drink something sweet or something cold. Lie on your left side so that you get the best blood flow to the uterus for baby, and then start to time on the clock. And then you just count how many movements or kicks the baby does. Once you get 10 movements or kicks, you can be done. But if you get to 2 hours on the clock and you haven't had the 10 movements or kicks, then that's when we have concern, and we would recommend that you come up to OB triage so that we can monitor the baby and make sure everything's going well.